In this video, we are going to explain how knee embolization is performed at the Florida Interventional Institute. First, a catheter, or a thin plastic tube, is inserted into an artery in your groin. This catheter is then carefully guided with the help of X-rays towards the knee. Subsequently, it is guided into the smaller vessels that supply blood to your knee joint. Once the catheter is in place, tiny beads, smaller than grains of sand, are released. These beads enter the small branches supplying the knee joint and get stuck in the branches due to their size. This process effectively reduces the blood flow to the inflamed tissues in the joint. This helps to bring down joint inflammation, providing pain relief. If you would like to know more, please call us or visit our website at flinterventionalinstitute.com.